Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to Health Matters, a comprehensive chat by the Islamic Medical Association, your regular Tuesday night slot. And tonight we have a slight difference in the speciality because we've been concentrating mainly so-called medical specialities. But tonight we welcome Dr. Nadeem Karachi, a maxillofacial surgeon from the Center of Excellence in medicine at Waverley and Center Medic Clinic. Assalamu alaikum, Dr. Karachi.
Wa alaikum salam, Dr. Essack. Thank you for having me.
Alhamdulillah, alhamdulillah rabbil alameen, wal aqibatu lil muttaqeen, was salatu was salamu ala ashrafil mursaleen, Sayyidina Muhammadu wa alihi wa ashabihi ajma'een. Narrated Abu Huraira radiallahu an, that Allah's Messenger sallallahu alayhi wasallam said that every Monday and Thursday the gates of paradise are open. Allah Ta'ala forgives every slave who associates no name in worship with Allah except those who quarreled with one another. Allah says to the angels, leave them until they reconcile. As you can see from this hadith, that if we are quarreling and we do not resolve our issues, Allah holds back His mercy from us. So it is prudent and wise that after we do have our differences, that we reconcile as soon as possible as good, true, sincere Muslims. So we're talking about the maxillofacial area, so I thought we'll talk about this hadith. We perhaps maybe try not to quarrel, inshallah. Assalamu alaikum, Nadeem, once again. The topic tonight is going to be dental implants. But before we get our teeth into that, I think it's very important for the viewers to understand the differences between these specialities that have some kind of common area, which is ENT surgery and head and neck surgery in your area. So I don't know exactly where the knives are drawn, but perhaps you can just explain to us.
So maxillofacial surgery, ENT surgery and head and neck surgery, they're all specialities. There is a bit of overlap, especially when it comes to pathology, where there's an overlap between ENT, general surgery and head and neck surgeons. By and large, ENT surgeons and head and neck surgeons treat cancer cases and oncology cases. Some maxillofacials, depending on where you've qualified and how you've been trained, can also treat that. But so there is a distinction drawn between cancer cases and also where the pathology arises from.
So there is definitely a clear distinction.
There's definitely a clear distinction between ENT surgeons, head and neck surgeons and maxillofacial, although there is areas of overlap.
Okay. All right, so I suppose that will come in the referral.
It comes in the referral, and often sometimes a patient is referred to, say, a maxillofacial surgeon, and it's never a waste. Okay. Even if it's not covered by the maxillofacial, the maxillofacial can always refer to the appropriate specialist. Yeah.
Okay, Jazakallah for that. So now, tonight's topic, dental implants. I think the best way to start is, what are they?
So basically, dental implants are surgical components that are placed into the bone of your jaws, and it's used to anchor a dental prosthesis. So a dental prosthesis is anything from a single crown for a missing tooth, or a bridge to replace several teeth, 1, 2, 3 teeth, or even just to anchor and retain and provide stability to dentures.
Okay, so now that we know what are they, how do they work?
So how they work, they look like self-tapping screws or threads, and they inserted into the bone, and the whole process of implants is a process called osseointegration. But just to put it simply, is that the implant and your natural bone of your jaws forms an intimate relationship, and the bone actually grows onto the surface of the implant.
And is that the way they function? Once you've inserted them?
So once it's inserted and once it's integrated with your bone, and once you have that intimate relationship, then a crown or any dental prosthetic is anchored to the implant by means of some mechanical components.
Okay, so there's a few processes involved.
There's a few processes. It generally starts at your dentist, who will then refer you to a surgeon, and you'll work together and decide on a plan. And
so why would a dentist then refer, and under what circumstances would he'll be the first port of call, he or she?
The dentist is usually the first port of call.
And then they determine the need or a possible need for an implant. They will then refer. So what kind of indications does a dentist see before he does this kind of referral?
So generally the indications for an implant is anything from to replace a missing tooth or several or a few teeth. There's also an indication for to retain and to provide stability for dentures. The other indication is in certain orthodontic cases, it provides anchorage to move teeth.
Okay, and I'm sure there must be some risk factors. I mean, for people requiring implants. I mean, not everyone has had an implant, and thank God for that, because it's pretty expensive, but perhaps you'll tell us that, inshallah. But what are the risk factors?
So with any surgical procedure, there are risk factors. The important thing is just to have a comprehensive consultation, and any risk factor can be minimized or eliminated, and it just depends how you alter your treatment plan and your surgical procedure.
What's the role of smoking?
Smoking delays wound healing.
Okay.
It also causes vasoconstriction of your blood vessels. Right? It also smoking also delays your wound healing. So in combination with implants, it's not an absolute contraindication. However, it does increase the risk of an implant failing.
But prior to that, smoking can damage teeth, is that correct?
Smoking can damage not only your teeth, but the soft tissue of your oral cavity, as well as your oropharynx, your lungs, a host of other issues.
So it plays a big role actually in this.
It plays a big role. One of the prerequisites for implants is to have healthy bone and healthy soft tissue that is going to surround those implants. So smoking does have a negative effect.
And when patients come to you, when you're determining the suitability of inserting these implants, so you mentioned things like healthy bone and healthy soft tissue. What's the process of determining suitability for doing the implant procedures?
So it's
what are the criteria?
Yeah, so the criteria is basically healthy bone, healthy soft tissue surrounding that implant, and just a general medical history. So the assessment of any medical comorbidities and how we would go around it and manage those. And then also the assessment is, the adjacent teeth, the adjacent structures. Is there a need for an implant? Will we get what the patient expects? Are we going to restore function? Is it going to be aesthetically pleasing? So every case is unique and judged uniquely and on its merit.
You mentioned medical comorbidities. Any specific ones that stand out?
I think now, look, the diabetes, the heart conditions, osteoporosis, and these are all, we stick to our basic principles of surgery, and we manage these accordingly. And in any of these patients, implants can be placed safely and with good results.
Okay. Now, one of the issues that comes up, obviously, is many reasons for teeth falling out, and there's an age spectrum. But I think perhaps we should maybe inform us as to what is the minimum age that you would consider implants. Because we find a lot of young boys and girls playing a lot of sports nowadays, a lot of contact sports, and even sometimes just during the general life of a kid. Sure. You find their teeth have fallen out and knocked out, and parents suddenly feel, now with the increased information available and accessibility to specialities like yourself, can we put in an implant? So what would be the most prudent age to start considering this, and what is the youngest age you would ever think about something like this in this current day and with your current knowledge in technology?
Yeah, so with implantology, you can place an implant as long as the patient has stopped growing. Because if you place an implant, it's not like a tooth. There isn't movement, there isn't remodeling. It's sort of anchored into your bone and it will stay in the same place.
Because it's not natural.
Because it's not natural. So ideally, you'd want to wait until growth is complete in the patient.
So what are you looking at age-wise? Ballpark?
16, 17 for females, 18 for males.
Okay. In your experience so far, what have been the main reasons for patients coming to you or being referred to you?
In my experience, it's to replace either a single missing tooth or to replace crowns that are always loose, or to replace a few missing teeth. I've also had a lot of patients, elderly patients, who have loose dentures, and just 2 implants on the lower jaw can retain and provide enough stability to a lower denture.
We'll come to the elderly because it's a very specific group, but it's got a very interesting discussion so far. We'll take an ad break. Please do tune in and start getting ready to make your calls, because Dr. Karachi is ready to answer your questions. The lines will be open soon, and we'll see you shortly after the ad break. Assalamu alaikum. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Health Matters, a comprehensive chat by the Islamic Medical Association. We're discussing the dental implants with maxillofacial surgeon Dr. Nadeem Karachi. We went through a few indications and some risk factors and what are they. But it's actually nice to actually see what an implant looks like. So perhaps slide number 15 will come up on the screen shortly. And while that is coming through, Nadeem, I don't know, from my little experience in my medical practice, because obviously we don't see that many dental patients. Sure. But this is like a conversation that occurs even at dinner tables, right, about implants and things. And people seem to be wanting it for aesthetic reasons. But there must be medical reasons. So which is obviously medical will be more important. So how do you then deal with patients for aesthetic versus medical? What kind of distinctions you make? What advices do you give?
Sure, it's both. It's medical as well as aesthetic reasons. So, I mean, if you just consider the consequences of tooth loss, is a loss of function, movement of your adjacent teeth, loss of bone, poor function. Aesthetic is usually in the aesthetic zone, so in your anterior teeth, usually with poor aesthetic crowns, or patients want to get a better aesthetic result. And instead of crowns, you can remove it and try and achieve a better aesthetic result with implants.
So you're saying that there's definitely an advantage for implants over crowns?
Not always, Dr. Essack.
So when does that happen?
So there are indications when if there's missing teeth, and you have to assess every patient and every needs. You have to take it all into account. So, for example, an alternative therapy to an implant would be a bridge. And a bridge is where the adjacent teeth are prepared and a dental prosthetic is placed over the teeth. So not in every implant is not indicated in every case.
Okay. So it's not the be-all and end-all of
it's
all
not, it's
tooth loss. So if your teeth are gone, you go for implant.
It's been made out, there's been a lot of coverage on implants recently, but there still is a place for alternative treatments.
So just to clarify again once more, bridge, the decision about bridges made by the dentist, by yourself, or in conjunction with?
I think it's a combined decision.
Conjunction with each other.
So with the dentist, with the patient,
and
obviously with the surgeon talking to the dentist.
Okay, the lines are open, so please do call in with your calls. The number is going to appear at the bottom of your screen, and there it comes through 011 086 7700 or 1 or 2 or 3. Please do call in. I'm sure there have to be some calls on dental implants today, inshallah. So while we're waiting for the callers to line up, inshallah, there's 2 areas, right? Is the whole planning procedure What do you do? But before we get to that, I just want to clear up one thing. What is the gap between an extraction and an implant? Because sometimes people have an extraction and they feel, hey, you know what, now it's gone, let me get an implant.
Sure. Let's go to slide 19.
Okay.
Then, so also, I mean, it depends on from surgeon to surgeon. It also depends on the clinical situation. So it's not always possible, but in a lot of cases it is possible, and it does save a lot of time if you can place it immediately. Immediate placement is not as predictable as delayed placement, and sometimes it's better to err on the side of caution, and sometimes it can be done successfully, and it's well documented and well researched.
Okay, so apply a principle of patience and wait a little bit and make some cover and wait. It's another Islamic principle, inshallah.
Sure.
Okay, so in terms of your planning, how do you go about it?
So your planning is the most important thing in implantology.
Okay.
So your planning would include an initial assessment, but it's also in conjunction with the dentist who will restore the implant or place the dental prosthesis on. So it has to be at the right position, and it has to respect the position of the adjacent teeth. It has to respect the natural curvatures and positions of your jaws. So that's usually done in conjunction. There are surgeons who use their clinical judgment and place implants accordingly. And then there are other surgeons who use, for example, cone beam technology and surgical stents. So if we can have a look at a slide. We can go to slide 28.
So that is now you're discussing
the planning. So
planning in terms of
the position of an implant.
Okay, so positioning is very critical in this whole thing.
Positioning is very critical because an implant needs enough bone around it for long-term success, and it needs to be in the correct position.
So what are the slides showing there?
So what the slide is showing on the left is a cone beam CT scan.
Okay, that's the image.
That's the image, right? So it's a three-dimensional scan.
Right.
And then on the right is study models, and below that is what they call a surgical guide. So it's made of a plastic, and it has a surgical guide as to where the implant should come out or ideally be placed. So we can look at can go to slide 34.
Okay, before we do slide 34, alhamdulillah, we have a caller. Assalamu alaikum.
Assalamu alaikum.
Alaikum salam.
I have a question. Can dental implants be counterproductive to the body?
No, dental implants can't be counterproductive. They're made of titanium, and they bio-inert, so meaning they don't produce a reaction with the body. You know, that's provided the soft tissue around it is healthy, and there isn't any infection around the soft tissue or any loss of bone around that implant. But generally, no, they're not counterproductive.
Does it answer your question, brother?
Yes.
Jazakallah khair. Very good, excellent question. I'm sure many people wanting to ask that because that is a topical thing, because we want to know it's a foreign body.
It's a foreign body,
and how will it impact on your long-term health, not just within the oral cavity, but as a general
generally,
thing. Okay, so you're pretty confident that
No, we're confident. It's
you guys,
it's titanium, so it's
laying your head on the block for
inert. There's been a whole thing about dental amalgam, but I think that's maybe another show.
Okay, inshallah. Okay, so we're having slide 34 where we were discussing your
so we were talking about so about planning. So ideally, you know, around an implant you want enough bone surrounding it, and you must remember we're looking at a two-dimensional image.
Right.
But your jaw and your bone and your teeth it's three-dimensional.
Yeah, of course.
So in a three-dimensional aspect, positioning and planning and talking to your dentist and talking to your technician and relating this to your patient is one of the most important things in implantology.
So when a patient comes to you, now
Sure.
you've determined indications, you've decided that they need it, and then you're discussing this procedure that's going to take place.
Sure.
Do you go through this whole process explaining the three-dimensional and...
Yeah, we go through the whole process of the three-dimensional.
Right.
We have a stent made, and then we do a scan, and the patient is actually involved in the treatment planning.
Okay.
So all important anatomical structures, and we can talk about that also. All of those identified on the scan. The patient is involved in the planning, and we sort of make a decision from there.
From there together. Alhamdulillah, that's very good, but I think one of the things that comes up is the cost, right?
Sure.
And we've been hearing some mind-boggling figures
Yeah.
in terms of cost within private care. Is this done in the state sector? Just to get that out of the way.
To my knowledge, it is done in the state sector.
Okay.
So
is it a long
when I
procedure,
was
waiting
training,
list?
I think, look, to be fair, in the state, you are going to wait a bit longer.
So it'll be a waiting period.
There will be a longer waiting period.
Okay. All right. I mean, that seems to be the state in most things.
Yeah.
But as far as the private healthcare goes, cost can be an inhibiting factor.
Cost can be an inhibiting factor.
Okay.
And there again, Dr. Essack, it depends on who you go to, what brand of implant they're using, what the surgical fees are. And I think
where does the real cost come in? The actual brand? Or the
generally,
type of product?
I mean, most implants that are certified will work.
Okay.
It depends on surgeons' preference, what implants they like to use, or what brands they like to use. But generally, look, the bulk of the fee will come from surgical components.
But is there a big difference from brand to brand, or is it much of a muchness?
Look, there's not much difference. And then, I mean, you do get the other end of the spectrum that there's some dental implants are very expensive.
Okay.
But by and large, it's around the same price.
Okay, so it's same range.
The same range.
Okay. All right, that's important to know, and I suppose the patient will discuss it with you, and you look at the cost effectiveness and weigh up the risk versus the cost.
So what we do, we always weigh the benefits and the risks and the costs, and
together
try and give some indication as to how it will benefit quality of life.
All right, while we're on that, another thing that's in vogue at the moment is patients doing medical tourism.
Medical tourism, yeah.
All right, we'll get to that after the next call.
Okay.
Assalamu alaikum.
Wa alaikum salam. I was just calling to inquire if you need to be asleep or awake while the implants are placed. Like, do you have to have a general anesthetic for the procedure?
No, you don't. Not at all. It just incurs more cost, and depending on the number and whether bone grafting is done as well. But look, by and large, a single implant can be placed quite comfortably in the dental chair.
So does it depend on the number of implants?
Not necessarily. It depends on the number, the type of case, whether there's going to be bone grafting, so if there isn't enough bone. But yes, you can place a few implants on the chair. You don't have to do it all at once as well. You can always stage it. So you can do, say, one half of your mouth at a time.
Does that answer your question, sister?
Yes, I was also wondering, following the placement of an implant, should you expect a lot of bleeding?
Good question.
So it's a good question. One of the operative risks of placing implants is obviously pain, swelling, and bleeding. Post-operatively, I think with any surgical procedure, you shouldn't experience bleeding. Look, with oral surgical procedures, blood-stained saliva is common, but active bleeding you shouldn't have with most surgical procedures. You shouldn't have active bleeding.
With implants.
Yeah.
Sister, does that answer your question?
Yes, thank you very much.
Any more?
No, I'm fine, thanks.
Jazakallah khair. Good questions.
Yeah, good questions.
Yeah. So we're getting to this topic of costing, and there's a medical tourism has become vogue, where people are going abroad,
Sure.
where they're comparing the cost. But I mean, okay, and the cost is obviously an inhibiting factor for some people.
Sure.
And they've worked it out that with travel, accommodation, they can get it done cheaper elsewhere.
Sure.
So while that's an absolute thing, it's cheaper elsewhere. But then
Sure.
what are the long-term implications? Is there follow-up required? Will they need to go back and
Sure.
then travel again? What are the possible complications? Maybe you can answer that after our next ad break, inshallah.
Okay.
We'll see you shortly, and please keep your calls coming. Assalamu alaikum.
We're talking about costing, huh?
Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Health Matters, a comprehensive chat by the Islamic Medical Association. We're discussing dental implants with our maxillofacial surgeon, Dr. Nadeem, Karachi. We're discussing the benefits of going abroad and getting the procedures done at a much lower cost that we're aware of. But then we're looking at the long-term costs and complications, because obviously we're just not only looking at the rand value, but other things that may occur.
Sure. I think when it comes to costs, often patients have an implant placed and they never have it restored because they're not fully aware of the long-term cost and the cost of the entire procedure.
Right.
This medical tourism, yes, it is a big thing, but I think in terms of complications and what can go wrong, and also the brand of implants that they're using, we're not sure, whether how reliable these brands are.
We're talking long term.
We're talking long term, even short term, even mid term. If there's a complication, is it going to cost more to fly back and
get it done again,
and just have it done again? The system that they're using, is there backup at home for that system? So
what are the possible complications that can occur? I mean, now we're talking generally, whether you go abroad or locally.
Sure. So your complications it's operative complications, which we spoke about with the call.
Okay, so that's immediate, right?
That's immediate, and then you get early complications and late complications.
Want to list some of them first?
So your early complications would be infection or implant failure, or component loosening, and then your late failure will relate to bone loss, inflammation around the implant, and mechanical failure. So
you deal with each of those, obviously, as and when they occur.
So as they occur, I mean, you try and prevent it by proper planning and proper surgical techniques and restorative techniques. But as they occur, that's usually when it becomes symptomatic.
What is the rate of complications that could occur? I mean, so far in your...
Implants have quite a high success rate now, and technology has improved. So implants do have a 3 to 5% failure rate.
Is that the norm for South Africa, or is it a global figure?
I think that's a global figure. So contemporary research has shown us that for single implants, we're looking at a failure rate of 3 to 5%. And in cases where a patient has no teeth, then it's slightly higher, so 5 to 8%.
The lines are open. We've had some good calls. Please do call in. And as I'm talking about that, there's a caller. Jazakallah. Assalamu alaikum.
Assalamu alaikum.
Walaikum
I
salam.
have a quick question for Dr. Karachi. I reckon it will be important to make out of viewers. What is the healing period for screw-in denture? And in this case, I have a denture, so it's not as if the tooth has been extracted now. So I just needed to know what the healing process is. Okay?
Jazakallah khair.
Yeah, so for a denture that will be retained by implants, we'll place the implants, and 3 months later we'll test that the implant has integrated with your bone or formed a bond with your bone. And then 3 months later you can have an adjustment to your denture which will clip onto your implant. So you're looking at about a 3 to 4 months wait with the planning, if you take into account the planning and the surgical procedure and the wait.
Okay, thank you very much. Shukran. That answers my question.
Jazakallah khair. Taking on that question, I mean,
Yeah.
during that 3-month period, are there other issues that come up, pain and
Generally,
discomfort?
with any surgical procedure, a bit of pain, swelling, bruising, discomfort, yes, can be expected, but it's always minimized by the medication and the mouthwash that we prescribe, and also by good surgical technique.
Do you guys routinely prescribe things like antibiotics for circumventing infections, or is that based on a case-by-case basis?
It's based on a case-by-case basis. Also the patient's medical history and also the nature of the procedure. So in implants, generally a prophylactic dose would suffice. If it's an immediate and there's some pre-existing infection around the tooth, you may give implants, but it generally does change with case to case. There's no hard and fast
Okay, there's no
rules,
standard protocol for that.
There is research to indicate that just a prophylactic dose
And what do you give
should
usually?
suffice. Penicillin is the choice of antibiotic for oral procedures.
Do you still give flagyl?
Flagyl is a anaerobic,
Yeah.
so it doesn't cover the oral microorganisms. So penicillin is still
Still
the
okay, so
drug
it's
of
not
choice.
dual antibiotic, it's one.
It's one antibiotic.
Okay, the lines are open, 011 086 7700 or 1 or 2 or 3. Number appears at the bottom of your screen. Please do call in. Dr. Karachi would welcome your calls and your questions. Have been very good questions today, alhamdulillah. So we've been discussing complications, but these obviously one of the key elements
Sure.
is the quality of the bone, am I right?
Sure.
And how do you guys assess the quality of the bone, and what do you do about that, and the variance that occurs, your approach to that?
Yeah, we'll go to slide 30. So your bone, there's some surgeons who assess it on standard x-rays. So your standard maxillofacial x-ray is a panoramic x-ray. Your other methods of determining the quality of your bone is a cone beam CT scan. So it can be graded from grade 1 to 4, the quality of the bone. Even a poor quality bone is not a contraindication to an implant.
So there's quality and quantity.
There's quality and quantity.
Right. So you so far touched quality.
I'll touch on quality. So,
Right.
so quality refers to the density of the bone.
Right.
So quantity refers to the amount of bone.
Okay.
So an implant in all 3 dimensions requires
Both.
Requires both, yeah.
But
Even
do you
if there
see
isn't-
both on your cone beam CT?
on a cone beam CT, you can see quality and quantity of bone.
So the plain X-ray is limited value.
That's a difficult question.
Okay.
I wouldn't say limited value.
Okay.
I think it's when it depends from surgeon to surgeon when they were trained, how they were trained.
Okay. So
what they
a reasonable
comfortable-
assessment can be
But,
made.
definitely a reasonable assessment can be made on a standard maxillofacial X-ray. Yeah.
Okay, I'm just looking because I know the one of the limiting factors is cost in this whole thing. So a lot
Sure.
of patients have that issue. Okay. All right. So we got another caller. Alhamdulillah. Assalamu alaikum.
Kanya.
Assalamu alaikum.
Hello, can you hear me?
Yes, we
Yes.
can hear you. Go ahead with your question. Assalamu alaikum.
Okay, I have a question regarding bone density. Is there like a certain level of bone density that's required for an implant?
No. Look, bone density, it's It's more a technical term that we look at a scan or we look at an X-ray and we'll divide it into grade 1, 2, 3 or 4. But generally all 4 grades an implant can be placed.
Okay, my dentist says that I don't have enough bone for implants. Can something be done?
I think ask your dentist to maybe refer you to the surgeon that they use. And if you do a cone beam CT scan, a cone beam CT scan will show you in all 3 dimensions how much, or what quantity of bone and what quality of bone you have. And if there isn't enough quantity of bone, bone grafting procedures can always be done.
Okay, well, thank you very much.
It's only a pleasure.
You're welcome. Assalamu alaikum. Good question again.
Yeah,
so
that was a good
can you
question.
Explain a little bit about this bone grafting?
So let's
Let's
just see if we have a slide.
So not having enough bone is not the end of the road.
Yeah, let's go to slide 13.
So not having enough bone.
It's not the end of the road.
So where do you do the grafting from?
So depending on how many implants need to be placed or how much bone we need, we can either take it from the side of the jaw or from the chin area where large volumes are needed. That's in upper jaw and lower jaw cases. We'll take bone from.
So what's on the pictures there?
So on the pictures is it's just depicting different methods of grafting.
Okay.
So if you look on the left, that implant is just shining through on the top.
Mm-hmm.
And what we've done, we've grafted a piece from the side of the jaw and packed it on. On the right side is a technique called ridge splitting, and it's relatively minimally invasive. It's not as invasive as taking out blocks of bone, and it's basically where your bone is split and it's divided, so it opens like a book to increase the width.
So leading on from there, obviously now you're taking a bone from one part of the jaw area and you're placing it into the area where you're going to do the grafting for implant.
Sure.
What happens to the area where you're taking the bone out from?
The area where you take the bone out,
what is the aesthetic implications?
It's usually a non-functional area.
Okay.
So we'll take it out either from the chin or from behind your third molar area.
But no aesthetic issues?
There's no aesthetic issues, no functional issues. It is a second surgical site, but no functional or aesthetic issues.
Okay, alhamdulillah, that was very interesting. We'll take another ad break. We'll please don't go away. We still got the last segment of our program left. We'll see you shortly. Assalamu alaikum. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Health Matters Comprehensive Chat by the Islamic Medical Association. Our topic today is dental implants with our maxillofacial surgeon for tonight, Dr. Nadeem Karachi. So we had a very interesting discussion, Dr. Nadeem, and we're discussing this issue about bone grafting. So when you make this assessment of bone grafting, then of course the ultimate aim is to do the implant.
Sure.
So what's the time delay between the grafting and the placement of the implant?
So there are cases where you can secure your graft and place the implant at the same time.
Simultaneously?
Simultaneously.
Okay.
So sometimes you do have enough space to place the implant and secure the graft on either side of the implant.
So when do you make that decision? On the table?
No.
Oh.
You make that decision with your planning. Yeah.
Okay.
So
that's part of your planning procedure?
So it's part of your planning, yeah.
Okay.
And then obviously there's cases where
there is a delay.
You aren't able to place implants.
So
at
you
the
will
same
know
time.
beforehand it'll be a delay.
So you'll know before, yeah. So
and the patient will know about it.
And then
please do call in. The lines are open. The number is 011 086 7700 or 1 or 2 or 3. It appears at the bottom of your screen. We do have a few minutes left, so try and get your calls in if you want to ask Dr. Nadeem Karachi anything about dental implants for tonight. Nadeem, so when we're doing this kind of thing, obviously you're looking at anatomical structures.
Sure.
Well, something important about that?
Yeah, there are important anatomical structures to avoid or stay away from. So let's see if we can go, let's go to slide 20.
Okay.
So let's go to 21, yeah. Yeah, you see, so on your lower jaw, obviously it's your nerve that runs under your teeth and supplies sensation to your teeth as well as supplying sensation to the skin over your lip and chin
So you
area.
want to make sure that
So you want
remains
to
unaffected.
yeah, so you want to make sure you're about 3 millimeters away from that to avoid any complications with the nerve.
So it's okay, so that's a very
the
important
main
consideration.
That's one of the main, one of the most important considerations in the mandible, in the lower jaw, and the upper jaw is the maxillary sinus.
Okay.
If we go to slide 22,
So you're very close to the maxillary sinus.
yeah. So in this case, you can see the implant is close to the maxillary sinus.
Okay.
You don't want to go in to the maxillary sinus.
That's the black portion, right?
That's the black portion
Okay.
above the bone that is housing the teeth.
Okay. Have you guys had instances on maxillary sinus complications or nerve complications?
If your planning is there, so yeah, look, inevitably.
What's the incidence of those kind of complications? Low?
The incidence, look, where the planning is low. Yeah.
Okay.
So even on standard X-rays, the nerve is visualized very well.
Okay.
So
and in the event that something happens to that nerve, let's touch on the nerve.
sure.
What does the patient do?
In the event that there has been something that happened to the nerve, or the implant is impinging on the nerve, I think the best thing to do with any complication or with any discomfort for any patient is to call the surgeon and come for a checkup.
But can
And,
anything be done? Is it
rather-
permanent
rather
damage or is
sooner-
it?
Rather sooner than later. Nerves are quite rigid structures,
Okay.
so to damage a nerve
To be something serious.
permanently,
And sinus complications?
sinus complications, sinus, an implant can be a millimeter or 2 or 3 millimeters into the sinus with no adverse effects.
Okay.
Implants are bioinert. I mean, there's a certain type of implant that goes through your sinus into your cheekbone
And
with
problem.
no adverse
Okay.
effects. So, I mean, a
Alhamdulillah.
millimeter or 2.
Okay. So that's good to hear that the complication rate is low, the failure rate is low. So alhamdulillah, so it's a pretty successful area of work that you're doing in terms of implants. We've almost coming to the end of the show, and just want to get maybe perhaps your take on oral hygiene,
Sure.
regular visits to the dentist. Is that your take-home message for tonight?
I think, oral hygiene, we say implants can anchor dental prosthesis, but it can never replace what God has given you. So it's really a substitute. So oral hygiene, and maybe just visit your dentist every 6 months. They sort of pick up things, and rather sooner than later.
Okay. We have our caller, one more caller. It's the last caller for tonight. Assalamu alaikum.
Alaikum salam.
Islam.
My question is related to the implants on per tooth basis.
Yeah.
If I've lost more than one tooth, do I generally need an implant per tooth? Or
No, you don't. You don't need an implant per tooth. So I think with your dentist and with your surgeon, you can have a discussion. But 3 teeth can be replaced with 2 implants. So similar to a dental bridge, you can have a 3-unit bridge anchored on 2 implants.
okay,
Does
thank you.
Jazakallah. That's quite important because you were touching on the elderly, right?
Sure.
And obviously there's a fair amount of tooth loss and dental loss there.
Sure.
So, and it's a big psychosocial element for them to have some kind of functionality.
Sure.
So what do you do with that?
The elderly patients with dentures, usually it's the lower denture that moves around. and it just takes a minimum of 2 implants to retain a lower denture, and it can really change the quality of a person's life, their function psychosocially, emotionally.
Okay, that's a good point to end our show. We've had our take-home message and a very interesting show. I'm sure you all agree. Jazakallah khair, Dr. Nadeem Karachi, for coming on.
Thank you.
We hope to get you again on other issues, and you may even feel we haven't covered everything. So inshallah, and to you, the viewers, thank you for tuning in, and also for your calls. They were very good calls today. And inshallah, we'll be back on Health Matters next week again. Islamic Medical Association's health program for the week on ITV. So please tune in. And Jazakumullah khaira. Assalamu alaikum wa rahmatullahi wa barakatuh.